Hi, I'm Mark Norton. I'm a leading consultant orthopaedic hip surgeon based in the city of Truro, which is in Cornwall, in the southwestern region of the United Kingdom. I operate privately from the Duchy Hospital, which is a part of the Ramsay Hospital Group. I've been a doctor for 37 years, having graduated from the University of Cape Town Medical School in 1988. I specialise in hip surgery and I only do hip surgery. I've got 24 years of experience as a hip surgeon, having been appointed as a specialist hip and pelvic trauma surgeon in 2002. One of my specialties is in hip resurfacing. I use the ceramic on ceramic and metal on metal hip resurfacing implants, dependent on the needs of each person. I also perform total hip replacement, hip impingement surgery, and revision hip surgery. I've been a very active sportsman my entire life, which means that I'm very supportive of people with hip problems who are aiming to get back to sport, including sports which involve running or needing to twist your hip under heavy load, which can be a problem for standard total hip replacements. I've got a rare insight into the patient perspective when it comes to hip surgery. I've had my own hip replaced with a ceramic hip resurfacing in February 2026, so I really get it from the other side. I'm currently one of the few surgeons in the world able to offer a choice of both of the newly available ceramic hip resurfacing implants, and these are the Resurf and the H1 implants. I've got 24 years of continuous experience in hip resurfacing surgery, and I've performed over 800 resurfacing operations over that time. I was one of the surgeons invited to participate in the initial trials of the H1 resurfacing, which started in 2018, and I did 27 cases for that trial, so the trial results are part of my work. I've got a consultancy agreement with Matt Ortho, who manufacture the Resurf, and help advise on how to best introduce their new implant into regular service. I'm expecting demand for hip resurfacing to rapidly rise over the next few years due to the introduction of these new ceramic hip resurfacings. Unlike the metal resurfacings, they are fully licensed for use in female and male patients. That means for the first time in over 10 years, female patients can benefit from hip resurfacing again, rather than having to have a total hip replacement. I do also do a lot of total hip replacements. I've done around 7,000 total hip replacements in people as young as 16 to people over 100. I use a wide range of total hip replacements tailored to each patient's particular needs and anatomy, rather than using a one-size-fits-all solution. I don't currently offer robotic hip replacement. I don't personally believe that it adds sufficient value in hip surgery at present, although it may do so in the future. I was actually a very early adopter of robotic surgery, having been involved in the initial trial of robotic hip resurfacing in 2008. This used the Acrobot robot system. I really didn't find any technical benefit from robots for hip surgery and found that the additional steps and incisions added unnecessary time and risk to the operation. I do, however, offer personalized surgical planning and laser-guided, computer-assisted hip replacement surgery, which shows early evidence of being superior to the currently available robotic systems. There's evidence on this topic published in the Australian National Joint Register from 2025 if you wish to read more about it. You need to look up the 5-year results for computer-guided hip surgery and compare that to the 5-year results for robotic surgery. I've been treating hip impingement for over 20 years and manage about 100 people a year with impingement or dysplasia. I always try to preserve the original hip if it's possible, but if it isn't, I'm able to offer advanced resurfacing or replacement options to deal with the pain if it's appropriate. I'm very fortunate to work with a highly supportive secretarial team who respond rapidly to patient queries. I also work with a very stable, long-term team of highly effective expert anaesthetic colleagues and operating theatre members, so that my workplace always has a calm, efficient atmosphere which my patients are able to experience. The ward teams are a highly skilled team, but also very personable and give an amazing balance of professionalism and kindness. My website is www.ceramichipresurfacing.co.uk, where you can explore more about the latest in hip resurfacing technology. I'm also moderately active on LinkedIn if you want to get an idea about my professional opinions from interesting or complex case discussions.